Applestosen. It's Dr. Bob here with another health and vitality tip of the week. So this week is one of my most passionate things to talk about, and that's creating healthier future generations. One of the things you got to look at is if we are taking care of our children's children, and their children's children will be healthier. But that's not taking place right now. In fact, right now they're saying that the generation that's growing up will not live longer than their parents as we have in prior generations. So we can change that. So a lot of it's how we're moving our body or not moving our body, how we're eating, and how we are thinking and inputting information in the nervous system. So today we're going to talk about parenting and pregnancy. So if you think about it, when you're pregnant, the mother's belly is extended so much, it puts a lot of stress on the lower back. So making sure that the spine is in proper alignment is not only good for the health of the baby, but health of the mother. Nothing worse than back pain or leg sciatic pain during a pregnancy. Chiropractic is the most effective way to take care of that during a pregnancy to make sure that your spine and nervous system are functioning properly. 4 or 5 weeks after the conception, a baby's eyes and ears and nervous system start to develop. Your brain and nervous system are the very first system to develop because it has to run everything in the body. So we want to make sure that the nervous system is functioning the most optimally. So if you think about it, when a baby's in the womb, the spine is in a curled up fetal position. And as they come into this world, there's a lot of tugging and pulling upon the baby's neck that can happen at the point of delivery. This can actually affect respiratory centers. It can affect the nervous system at the most important part where the brain and the spinal cord hook together. So if there's a problem during the pregnancy, it can affect the first cervical. The first cervical, if you look at a nerve pathway chart, affects almost all systems. So it affects brain activity, affects the nerves that go down to the diaphragm for breathing. It affects all these areas for balance, coordination, growth, the immune system. And you can see it's like the main fuse of the entire body. It lights everything up on this nerve pathway chart. So a pulling, tugging upon a baby's neck at the point of delivery can be very traumatic. First symptom, babies might be colicky, or they could have some respiratory distress. So as a chiropractor, very specific, subtle little adjustments and movements to make sure that the nervous system is healthy is very important. I have 3 children. They're all grown now. I have now grandchildren that I check. And it's one of the most important things that I would always do for my children. The other thing we need to look at as far as when we're holding a baby. If we're holding a baby off to one side all the time with these heavy bags, it creates a lot of stress. So try and keep your body centered when you're holding the baby. Breastfeeding, obviously try and keep your body balanced. Use a lot of pillows to make sure that you're not leaning and twisting these. Otherwise, the uppermost part of the back and the lower back can really create a lot of problems. Now, the baby itself, when they're born, they should have a checkup, because coming through the birth canal is one of the single most traumatic events we can have on our spine and nervous system. When a baby starts to raise its head, it's important to make sure that we have the curves of the spine. The curve in the neck is very important. It makes your neck 7 times stronger. So as the baby starts to raise their head and lift their head, after weeks and months, they can develop these muscles and a proper nervous system. When they start to sit up and crawl and stand, the second curve of the form is developed in through the lumbar spine. This gives proper shock absorption, proper strength. So literally in the first year of development, a baby's spine is creating a blueprint for how the nervous system will develop. So babies should be checked when they're born. They should be checked when they can start to raise their head, when they can roll over, when they sit up, when they crawl, and when they start to stand and walk. Those are critical points of the development of a properly functioning nervous system. Think about it. We fall down thousands of times trying to take our first steps. So it's important that the baby's development is functioning properly through the nervous system, through the coordination, making sure the baby's checked, mother's checked during the pregnancy, making sure that you're trying to keep your body centered as you're carrying all these bags and the baby itself. All those things will put stress on the nerves. You may not always feel it because your body is only about 10% sensory nervous system. So you can have a problem developing that could be creating stomach problems, or could be creating arm and numbness problems down the arm, or tingling through the hand. So make sure that your body is centered. Make sure you get the family checked. Like I said, we have 4 generations of families, many of them that we take care of, the great-grandparents, the grandparents, the moms, and the kids. And your spine is your lifeline. So make sure that it's functioning properly right from the very beginning for a healthier future. This is another health and vitality tip from Dr. Bob. Have an awesome day, and Applestozen.